Hi everyone, this is Dr. Eyetemou Miguel, your pharmacist, and welcome to my channel. In this new video, we are going to talk about a health condition that affects a lot of people all over the world, but that is not so much talked about. This is angina pectoris. Angina pectoris is a heart disease as hypertension or stroke. It's a cardiovascular disease that is characterized by severe chest pain caused by a reduced blood flow to the heart. Coronary arteries are the arteries that supply your heart with blood. So when your heart is not enough or sufficiently supplied by those coronary arteries, you will feel then that chest pain and you will develop angina pectoris. What are the common causes of angina pectoris? The common causes are atherosclerosis and blood clots. Atherosclerosis is when fat deposits into the lining of your blood vessels, and blood clots is when your blood is clotting more than it should, more than normal. And in these two situations, you will find your coronary arteries narrowed. They will be narrowed, and less blood will then flow to your heart. Things that might contribute to either atherosclerosis or blood clotting are an animal-based diet, a lack of physical activity, tobacco smoking, aging, and also a family history of angina pectoris. The main symptoms are the chest pain severe pain that you feel in your chest that will sometimes go to the left arm, to the neck, to the jaw, or even to the back. We might also feel sick with nausea and also breathless, and we might also feel extremely tired. And the pain is a type of pain that that can be tight or dull, or you might feel something heavy in your chest. There are two main triggers: physical exertion and stress. So a crisis or attacks might come just after or when you find yourself in a stressful situation or during an intense physical activity. And usually angina pectoris attacks stops a few minutes after resting. There are two main types of angina pectoris. The first one is a stable type, which is more common and less dangerous. And the second one is a stable form, which is less common but much more serious, much more damageable. Now let's talk about the treatments. Your doctor will prescribe you glyceryl trinitrate, which will help you treat you in case of attacks, in case of a sudden crisis. To prevent further attacks, your doctor may prescribe you a beta blocker such as propranolol or a calcium inhibitor such as amlodipine. Unfortunately, sometimes angina pectoris doesn't come alone. It increases your risk of developing heart attack or stroke. So to reduce that risk of heart attack and stroke, your doctor may prescribe you aspirin that will reduce the formation of blood clots, or statins such as atorvastatin that will prevent fat deposits in your blood vessels, atherosclerosis, and also angiotensin converting enzyme inhibitors such as lisinopril, which are going to lower your blood pressure. And let's end the video with prevention measures. The first one is a plant-based diet. As we saw, eating too much animal-based food will increase your risk of getting angina pectoris. So to decrease that risk, you can start by adding more and more plant-based foods in your diet, such as nuts, seeds, fruits, and vegetables, and eat less and less animal-based foods. And also you can start doing some exercise, and if you are a tobacco smoker, it would be a very good idea for you to quit smoking. Thanks for watching the video, and please consider liking the video and sharing it to others around you, and also subscribing to my channel not to miss any upcoming video.